Now, are people with ME routinely being failed by the health service? That's the conclusion of a report this morning by the charity Action for ME. They say that people with the condition have to deal with what they call shockingly poor and patchy levels of care. In a moment, we're going to speak to Sonya Chowdhurry, the Chief Executive of Action for ME. But first, let's speak to Heather Gordon, whose 36-year-old daughter has had it since she was 10. Heather, a very good morning.
Good morning.
Just describe everyday life, if you can, for all of us who don't have a friend or a family member like you do. What is the impact of the condition on your day-to-day routine?
Okay, so Karen is totally bedbound. She's fed by tube. She can't eat or drink. She's severely sensitive to light and noise. She has to have her eyes covered all the time. She has a lot of problems such as pain, severe nausea, vomiting. She has been having problems tolerating her tube feed. It's a tube that goes into her stomach. For years, she's managed to have her feed like that, but the ME's got so much worse that she's now had to have the tube extended into her bowel, so the feed goes straight into her bowel, which is slightly better for the nausea, but it's still causing major problems. She's had many hospital admissions for kidney stones, but on the urological part of the hospital, she was treated very well. Our problems have sort of occurred more with the gastro ward at the local hospital. She's just had a very long admission where she was treated. The general nurses were okay, but one of the senior sisters, the matron, and the managers involved treated her with a lot of disrespect, ignoring her needs, ignoring the NICE guidelines, constantly demeaning her and putting her through hurdles, making her go through various assessments, such as capacity, when everyone said she definitely had capacity. They still made her go through an assessment.
What are the biggest challenges you have in sort of caring for her yourself as her mum, but just in ensuring the sort of quality of care that she needs?
Yes, yeah, absolutely. Because when we're at home, we have sorted out routines and ways of coping, helping her as best we can in daily life. At the moment, we've had a good example. She's recently been in hospital. She was in for 14 months and she came home. She's only given 1 month care package of IV support and anti-sickness drugs by a team that came in several times a day. But despite the fact she wasn't managing enough fluids down the tube, they just stopped the package, and it seemed like an arbitrary decision, not based on Karen's needs.
So you're saying it's confusing for you to see the treatment. We have spoken to the Health Trust, who say they are monitoring her needs, and they say that they often, patients with ME have a range of needs that often require complex multidisciplinary care. All treatment that we provide to patients is closely in line with the NICE guidelines. Heather, for you as a parent, you obviously want to mitigate, you want to reduce the amount of suffering that your daughter's going through. What would improve things, do you think, not just for your daughter, but for patients who have this condition?
It's the disbelief you face. It's the disbelief in the reality of life with severe ME.
And sorry to interrupt, the disbelief from who? Is it from the public at large or healthcare professionals?
It's from a lot of people, yeah. Some people are nice and understanding and kind, but the health professionals can cause such damage and upset and distress to someone with severe ME by their attitudes. And if you haven't got the basic belief in the illness, then they don't provide what the patient needs. They just ignore what Karen says throughout the admission. Of what her needs are, and she has articulated them very clearly. It's just constantly demeaning her and treating us badly as well.
So the challenge actually is not just dealing with the physical symptoms, but the emotional ones as well. As I said, we have spoken to the healthcare trust that are looking after Heather, and they've said in this instance, we're continuing to work with a range of experienced clinicians and specialist services, as well as the patient's family, to arrange a course of treatment that will deliver the best outcome for our patient.
Also
Yeah,
listening... Oh, go on, Heather, what were you going to say?
Sorry, well, we do dispute that very much.
No, I understand. And that's partly why it's really important to have you on the programme, to speak firsthand of what it's like. It sounds totally debilitating, stressful, and extremely painful as well for Heather.
Also listening to that, Sonya Chowdhurry, who's Chief Executive of Action for ME. Morning, Sonya.
Morning.
So your charity has looked at provision for this kind of care a bit more broadly. Listening to Heather and Karen's experience, how rare is that?
Sadly, it's not as rare as we'd like it to be. Action for ME hears from a number of people who have similar experiences. And we know that in the most severe cases, some people sadly die.
And what's incredible about this story in particular is usually when we're discussing stories about provision of healthcare, we always end up talking about money and overstretched professionals and not enough funding going into parts of this. But what was incredible about what Heather was saying was the constant demeaning, she said, that her and her daughter Karen were on the receiving end of, and facing health professionals who she suggested didn't have a basic belief in the condition that Karen said.
Yeah, that's correct. I mean, there are some fantastic healthcare professionals out there. They show compassion where they don't understand. They seek information. They try to understand a patient's specific needs. In many situations like Karen's, that's not the case. And we hear of professionals and others who don't listen to the patient, who believe that the illness is not real or that it needs to be treated in a very different way from the way in which the guideline stipulates.
But how in 2023 are we still in the situation where you could be facing a health professional, as Heather is by her own telling, who doesn't seemingly believe in your daughter's condition?
I think it's shocking. Action for ME hears from people like that all the time. We provide information support services and healthcare services, and we hear from people who repeatedly say their GP doesn't believe them. They've been admitted to hospital and they're told that they're just faking it. It really is unacceptable.
And does that viewpoint actually filter further up the healthcare chain to the extent that then money maybe isn't allocated to the care for this condition to the extent that it maybe should be because of that prejudice?
I think it has to. Otherwise, why wouldn't people's basic needs being met? We heard from the trust that you spoke to in Karen's situation, who said that that it's very complicated. We need a multidisciplinary approach. That is correct, and we know that money is an issue. But actually, the basic premise of compassion and listening to people and believing in their experience doesn't cost anything.
And yet, this ends up with Karen not necessarily getting the care that she needs, as her mother Heather was explaining to us. That they're even struggling to get intravenous feeding at home, as Heather explained. How common is that as a problem? Because that seems quite fundamental.
Again, Action for ME hears from a number of people that face similar experiences where there is short-term intervention. We know that, where somebody is so severely affected as Karen, they are going to require long-term care, long-term input. And yet people are repeatedly fighting for drugs, having to get repeat prescriptions just after a few weeks or a month, having to repeatedly have assessments done, even though there's no indication that their needs are going to change. Conversely, where people are less severely affected, we have individuals that are not being seen by their doctor. Action for ME's report that we've just launched today indicates that in 3 out of 4 NHS trusts and integrated care boards, the clinical guideline for ME is not being implemented, and that's unacceptable.
Good to talk to you this morning. Sonya Chowdhurry, Chief Executive of Action for ME. If you're in a similar situation to Heather, maybe you haven't got ME to the extent that her daughter Karen has, but you may be facing some of the similar problems, studio@times.radio is our email, and you can text us as ever, 87222. Start your message with the word Times.
And thank you too to Heather Gordon speaking to us there about the experience of looking after and caring for her daughter Karen.